Hi, I'm Dr. Dan Rubin, a board-certified naturopathic oncologist practicing in Scottsdale, Arizona. I'm here with two colleagues. First, Dr. Belinda Barclay-White, a board-certified radiologist specializing in breast imaging, and Dr. Jeanne Stryker, a board-certified fellowship-trained interventional radiologist focusing on localized treatment for people with cancer, both primary and malignant lesions. And we're here today really to discuss cryotherapy, and in our series we'll be talking about different aspects of the use of cryotherapy, including concomitant other therapies, the use of the immune system, and basically let's start out and talk about how we came to love cryotherapy. Dr. Barclay-White, what about yourself? What got you interested basically in imaging, but especially cryotherapy?
So I am a radiologist that's been specializing in breast imaging actually for about 30 years. And I have a very loyal patient base. And as my patients have aged, and we are diagnosing these cancers smaller and smaller, I just became very aware that I really felt we were over-treating them. Particularly, I have some patients that are like 60, 70, 80 that are still coming in for their mammograms. We're finding these 5-millimeter tumors. And they're...
Which is small.
Very small. Okay. And the standard of care is lumpectomy and radiation.
Which is a surgery followed by radiation.
Yeah, a surgery and then radiation and all the complications that sort of go with that. A hospital stay and, infection and scarring and all of that. So I actually started sort of shopping around for ideas of, is everyone still doing lumpectomy and radiation, which I was taught in medical school. Nearly 45 years ago, right?
Yeah.
Actually, it's longer than that. Otherwise, that makes me 15. Yeah. So basically, I became aware of cryotherapy and started reading sort of the world literature and became quite excited. And about that time, a company came to me who had just come up with a probe specific for breast. Because we've been doing cryotherapy of prostate and other areas for quite some time that I was aware of. And I started very cautiously presenting to my patients that this could be an alternative therapy, informing them that we know very little about it, but it is working throughout the world, and immediate interest from everybody.
I would assume that they would have great interest in the way that you could explain it in terms of reduction of scarring and maybe, shorter healing time.
I'm actually doing them under local anesthetic in my office now. So, they come in with a breast cancer and they leave without one. It's very exciting.
Oh. I have always been a fan of localized treatments. I think if you can utilize a treatment and administer it directly at the offending source, in this case a tumor or cancer cells, then you have less chance of side effects and a greater opportunity for treatment cure. Dr. Stryker, how did you come to be enamored with or involved with cryotherapy? I'm assuming as an interventional radiologist you've been practicing and treating localized tumors for several years now, but when did you start cryotherapy?
So I started doing cryotherapy actually in 2010 when I was doing my fellowship. So a lot of things that were happening behind the scenes that I wasn't aware of, being out in practice, doing radiology and specializing in women's imaging. So we started doing it in Charleston, the cryotherapy. And then when I finished, a lot of us are creative thinkers, think a little bit out of the box.
That makes a great physician.
So, I started thinking about, cryotherapy and different organ systems, and we do cryoablation for liver lesions, but we really weren't getting anywhere outside of the liver. And, I saw patients coming in with breast lesions, with pancreatic lesions, prostate lesions, but importantly with the breast. And I thought, knowing what cryoablation does, that it kills cancer, and I started looking into that more and started doing a lot of it and had a lot of really great outcomes.
Wonderful. And cryoablation or cryotherapy are both similar terms for the use of coldness versus heat. So it's the application of cold to diseased or cancerous tissue in order to do what?
Well, to freeze and kill the cancer cells.
So that the cancer cells actually get killed by the temperature.
Yes. So we actually place a probe, or I place a probe through the center of the cancer, and we freeze it There's a very definite protocol. We usually do 2 freezes, 8 minutes apart. So maybe an 8-minute freeze, an 8-minute thaw. Actually, I think it's 10 8-minute thaw and then 10-minute freeze for a bigger tumor, and 6 10-minute thaw still, and then another 6-minute freeze for a smaller tumor.
So it doesn't take that long.
It doesn't take that long, and we can do it under local anesthetic with ultrasound guidance.
So there's not much patient discomfort at all?
It's really not any worse than having a needle biopsy of your breast for diagnosis.
Dr. Stryker, is cryotherapy safe? Breast cryotherapy specifically?
Absolutely, it's safe and it's repeatable.
What does that mean that it's repeatable?
So a lot of times patients will go in and they'll have a lumpectomy, and then the margins might not be clear, so they have to go in and have another surgery. And you're undergoing a surgical procedure, you're undergoing anesthesia, there's associated side effects. When I say repeatable, we can see under ultrasound guidance or CT guidance, we can see that the ice ball is covering the lesion. But what I always tell patients is we can't see cancer cells. So there could be cancer cells that are kind of on the outskirts of it. So I always go beyond. But
you freeze a little bit more tissue,
yes,
just so a little bit of healthy tissue, which is okay.
But when I say repeatable, we can go back in if, like, say, a couple months later, we always follow up with blood work, with imaging, and I know we're going to be talking about another effect later on, but sometimes things will get exposed that were hidden. When you
mean other cancer cells?
Yes.
Got it.
So that's why I say repeatable, and there's less risk.
And I think what you were talking about, we were going to talk about later, is the abscopal effect.
Correct.
Yes, and we will talk about a global systemic-wide immune system response in a subsequent video. How can patients find you?
On the website, drstrykermd.com. That's drstrykermd.com.
Wonderful. And Dr. Barclay-White, how can patients find you for breast cryo?
So it's breastcryo.com or azbreastnet.com.
Wonderful. And I'm Dan Rubin. Our URL is listenandcare.com.